All right. So now we're going to talk about propionic acid derivatives. Can you say propionic acid derivatives? You did great. Let's talk about this, and then I'm going to give you guys a break. Does that sound good? Okay. So we are going to, when we talk about this, we're really talking about ibuprofen and naproxen. Those are the two most common kind. Okay. So remember, we have brand names and we have trade names. So sometimes people will say, oh no, I'm allergic to ibuprofen, so I take Advil instead. Is that possible that somebody could be allergic to ibuprofen but not be allergic to Advil? No. I'm going to be honest with you, sometimes it is. What happens is Advil, I have seen a lot of patients who are allergic to brand name Advil, and it has to do with the coloring and the fillers that they use, but they can take generic ibuprofen, okay? So double check, just make sure that you confirm with people about that, okay? Over the years, we used to think that ibuprofen was incredibly safe. We're finding out that ibuprofen has some nasty side effects for some people, for a small portion. Sorry. For a small portion of the population, we're seeing that people who take a lot of Advil or a lot of ibuprofen, their blood pressure is going up, and they can also have angioedema. What's angioedema? Right, it's swelling, especially around the lips, okay, but in the face. All right, so it's got all of our things that all of the other NSAIDs have. Our drug interactions, why do you think it's going to interact with warfarin? Right, because of clotting. And then phenotone is something that we use for seizures. And we haven't talked about that yet, so you don't have to worry about that for this next exam. We are going to be really careful. It's going to affect our liver and our kidneys. Ibuprofen and naproxen affect our kidneys more than our liver. Okay? That's important that you know that. Affects our kidneys more than our liver.
Does aspirin affect your liver more?
Yes. Aspirin's going to affect our liver more. Remember we talked about that people with asthma may have an anaphylactic reaction to aspirin. They could also have an anaphylactic reaction to these drugs. Okay? So our folks with asthma, we have to watch them carefully the first time they take it. All right. Now, ibuprofen and naproxen, people sometimes get gastric distress, so we tell people to take it with food. Is that COX-1 or COX-2 that's causing the gastric distress? Right, it's COX-1. All right, so it suppresses the prostaglandins. Let's see. This September 2014 study, I have not seen it repeated. Nobody had clear idea why this happened, but they noticed that there was an increased incidence of blood clots basically in the heart. But it has not been repeated, and I haven't seen more studies about it. But just keep an eye. I think we're probably going to see more research about that as time goes by. We need to be careful. Be careful. The polypharmacy, right? If people are taking aspirin, people might say, "Oh, I'll take Advil," or maybe I take naproxen, and then I'm going to throw in some Advil on there. Now, that being said, I want to put a little star next to this in your chart, because sometimes we tell people if you're having a really severe fever or you're having really severe pain, it's okay to stagger a little ibuprofen with some Tylenol. Tylenol is not an NSAID. Okay. Tylenol is a different drug category. It is not an NSAID. So if you have really severe pain or really severe fever that you can't get rid of, we might stagger Tylenol and ibuprofen, but we don't once we're taking ibuprofen, we don't take the other NSAIDs. Does that make sense? We're not going to take any other NSAID. We're not going to take more aspirin. We're not going to take more naproxen, anything else. You good with that? Okay. All right. And then, what's this? Tell me the sign of GI symptoms. There's one more, or GI bleeding. There's one more sign of GI bleeding besides the pain and people becoming anemic. What do we want to tell them to look for when they go to the bathroom? Blood in the stool. Are you going to see bright red blood? You're probably going to see more like just dark and tarry stools, right? Remember that the blood that you see in your stool, if it's bright red, is probably closer to the opening, right? So you're thinking like maybe hemorrhoids or a polyp that like is bleeding or something. But typically blood that comes higher up, it's going to be digested, so it's going to be dark black. Okay? All right. Why don't we stop there? When we come back, we'll do the COX-2 inhibitors. All right? You guys doing okay with this?